Our presentation is on assisted reproductive technologies. This is the outline. Assisted reproductive technology is the medical procedures that focus on the treatment for infertility and help individuals and couples in achieving conception. So basically, the assisted reproductive technology is a medical field that deals with helping couples or individuals who have fertility issues to get pregnant. There are various forms, and then these are the in vitro fertilization, which is the IVF, embryo or gamete carrier preservation, intracytoplasmic sperm injection, pre-implantation genetic diagnosis, gametes intrafallopian transfer or zygote intrafallopian transfer, donor sperm, eggs, and embryos, surrogacy or gestational carriers.
So, talking about the equipment used in ART, you have the incubator, the refrigerator, the cryopreservation equipment, which comprises of the liquid nitrogen tanks. Then you have the laboratory centrifuge and PA device and temperature monitoring. We'll move on to the personnel required for these processes to be carried out successfully. We have the medical director, we have the individual with expertise in gynecologic ultrasound. It can be the physician, technician, or nurse. The laboratory personnel to perform or handle the tests of the embryo, eggs, and the sperms. You have the mental health professional with fertility counseling experience. And we also have the genetic counselors. Then the last one, we have the nurse with training in reproductive medicine and arts. Thank you.
In vitro fertilization is a method of assisted reproductive technologies in which a man's sperm cell and a woman's ovum are fertilized in a laboratory dish. The fertilized ovum is now being transferred into the uterus and implanted in the uterine lining for growth and development. The in vitro fertilization is indicated for women who have blocked, damaged, or absent fallopian tubes. It is used for conditions such as endometriosis, male factor infertility, and also for women with advanced age. The IVF have 5 treatment cycles, which are the ovarian stimulation, which is also known as the ovulation induction, egg retrieval, fertilization, embryo culture, and also embryo transfer. Now, during the first stage, which is the ovulation induction, fertility drugs are now being given to the woman to stimulate the eggs to mature. Now, when the drugs are in 2 forms, we have the oral drugs, then we have the injection, which is in the form of hormone. So with the oral, we have the clomiphene citrate and the letrozole. Then we have the hormone injection, which is the follicle stimulating hormone, utilizing hormone, and also the HCG. Now, at the second phase, which is the egg retrieval, the woman will undergo 2 minor surgeries. That is the laparoscopy and also the transvaginal ultrasound aspiration. Now, this is used to retrieve matured eggs. The mature eggs now will undergo the fertilization treatment cycle, which is also in 2 forms. So we have the first one that they will put the egg and the sperm together in an incubator, and the second one, they will take a single sperm cell and inject it into the center of the egg cell, which is also another form of the assisted reproductive technology, which is called intracytoplasmic sperm injection. Now, this form of arts can also be used for men who have low sperm count, poor motility, who have abnormal sperm shape. At the third stage, after the fertilization, the ovaries are now being transplanted into the uterus of the woman. Now, the excess ovaries or the embryo can be frozen for future use, or for women who have undergoing cancer treatment or those who want to delay childbearing. Now, this form of freezing the egg is also another form of the assisted reproductive technology, which is called cryopreservation. The next one is that they will also test and screen for specific genetic diseases so that they don't pass any genetic diseases to the embryo. And this one too is also another form of the assisted reproductive technology called pre-implantation genetic diagnosis. Now, when we take the IVF, it has success rate of 30 to 45%. And the IVF has some risks, and also the risk happens when we have an issue of ovarian hyperstimulation syndrome. Now, in this condition, there is also accumulation of fluid in the chest and abdominal cavity. There is also the issue of gastrointestinal symptoms such as bloating, nausea, vomiting, and anorexia. At the severe stage, there is an issue of weight gain, electrolyte abnormalities. We have blood clots, kidney failure, and even death. Another risk is that there is the issue of multi-fetal pregnancy, which normally can increase the risk of prematurity or preterm delivery. Now, since the couples who are expectant undergo this IVF process, there is the issue of psychological, emotional, financial, and physical stress that comes out with it if the procedure fails. So I will end there for my next presenter to continue. Thank you.